Welcome to REM Community Connections with Mary, the podcast where we connect with the people, businesses, and organizations making a positive impact in our communities. I'm your host, Mary, and each episode is all about sharing inspiring stories, valuable resources, and meaningful conversations that help families, professionals, and community members stay informed and connected. I have Tasha, co-host, and also special guest Rebecca joining me today.
Thanks for inviting me. Looking forward to today.
We're happy to have you. So, I am Tasha Gaitan, and I am the Director of Community Relations for Magnolia Court Assisted Living here in Vacaville. And with us, we have Miss Rebecca. Go ahead and formally introduce yourself.
Okay.
And Always Best Senior Care.
Thank you. So I'm Rebecca Smith. I'm the owner of Always Best Care Senior Services. I opened the agency in Solano County, actually in Vacaville, in 2016. So it's been a little bit over, just a little over 10 years that we've been open and established. And we provide all sorts of different services for seniors. It's a great resource, but we're not limited to just in-home care or placement. We also now provide home health, and we've been expanding into Napa County as well. So we've been in the industry for a little while.
When did you start doing home health?
So home health was an exciting, long journey. That was took almost 3 years to get through. Yes.
It's a good combination.
It's a great combination. We're much more of a care navigator of an agency than we are of, like, I know we used to kind of say, we're concierge because we help with multiple things, but I feel like we're able to be better at navigating families, resources, and kind of handling as a whole. So we went through accreditation and survey beginning of last year with ACHC and Medicare finally provided our number in early March this year.
That's amazing.
Yeah. So now we're just going through the insurance process, and we have home health patients, a low census right now, but we're expanding as insurance contracts come in and it grows. So, yeah.
Definitely. Okay, so what inspired you to start Always Best Senior Services?
So that's a good question. My previous career, I was a dental hygienist. So I worked with generational. Oh, thank you. I worked with a lot of generational families. And so the timing kind of fit. My kids were getting older. I felt like I wanted to do something more to give back to those in my community. I grew up here. I've been here since 1975. So it's like, we moved here when I was little, and I've stayed here and went away to college and came back. And so I just really wanted to be able to give back. And I started researching ways to do that. I grew up, my parents were self-employed. So kind of the self-employed heading down that trajectory didn't seem too foreign for me. But getting into senior care was interesting. It was mostly from my patients that they would come in and family members would start asking, did you notice, grandpa's starting to forget things? And then, or my mom is having this issue. And then people would start asking, do you know any place or anybody how we can get help? Like, I need help with dad at home. And I don't know why the dental environment created those kinds of questions, but it did. And I just started researching, and I wanted to be able to use my knowledge skill set to help give back, and it just led me down the path of senior care.
That's amazing.
So.
Wow.
Yeah.
That's great.
Yeah, thanks.
I think dental offices are definitely places where you got to feel comfortable.
Yes.
And you got a lot of time together, right?
One-on-one time. And you've got to know disease processes and medications and pharmacology and all that stuff. So a lot of it kind of rolled into having knowledge base of care.
My daughter actually works at a dentist office, and she was telling me that they always go in there and they're, talking, or they have dementia.
Yes.
So she knows. She's like, it's okay. Like, sit down. We're gonna do. What is it? The mold.
Yeah.
Oh,
So
yeah.
she
For
talks.
dentures
Yeah.
and stuff.
So she talks to them, even if they're doing like the X-rays. So she's like, yeah. She's like, I used to work at a senior community, so I got this.
Yeah.
So the families are always like, well, I'm so sorry. She's like, that's okay. Like, we got this.
Yeah.
So yeah, that's true. That working in dentist does help.
There is.
And they're going to ask questions where they feel comfortable, and
Yeah.
they're probably so starved for knowledge. They're just trying to find out anything, anywhere they're at, right?
Yeah. To get any kind of, help and guidance and advice. And I mean, when you think about it, I mean, you do actually really trust your dental staff, like your medical staff, right?
3 inches from
Like-
your face.
Yeah. And you see them. I mean, especially when I was doing hygiene, a lot of my senior patients I'd see every 3 or 4 months. So you do build that, relationship that when family comes in, you start kind of learning what's going on.
Okay.
Yeah.
Well, what makes Always Best Care stand out from all the other care companies here?
Right? I mean, I think all of us have so much to offer, and I think that there are more people that need help than any of us could help combined. I do think that I've grown the agency so that, as I had mentioned, we're more of a care navigating service. We're able to sit down and really help people navigate the options of care that are available and, be able to help them with some of them. I would say we have quite a few people that we have helped over the years that we've never even actually provided care for in any fashion, but just guidance and resources. Also having, people that we've helped and guided, and it'll be like 2.5 years, we've had somebody where then the family's ready to initiate care. And just because we've kept in touch, just because we've helped them with certain situations, they, feel comfortable of coming back. So I think the navigation aspect where we can help with the home care, the home health, and if it becomes that they're unsafe at home by themselves, or it's not financially feasible for them to stay home, then sending them to people like you, Tasha,
I
who
really
are
love,
fabulous.
I love that aspect of being able to not just provide them placement, but also like the continuance of care.
Yeah.
Because I'm doing this as long as I have. I'm a firm believer in you should get a home health evaluation and be
Yes.
on it every single time you move, every time you have an issue or a setback or a health thing going on. So having that already step done through
Right.
you when you would place somebody.
Yes.
It's one thing that I have to do. They come with all the education already and home health provider.
Exactly. And I think it really helps set families at ease.
I think it does.
Because most of the time, even if they have an inkling that this transition and journey's coming, none of us are prepared for it. I mean, I know even with my own mom, my sister and I, we knew it was happening, but we weren't prepared for it.
Kind of different, right?
It is. It's very different when it's personally involved. And when people are having those crisis situations where all of a sudden, they've got their lives, their kids, their work schedule, and now they need to step in and help mom because she just fell, or dad or somebody, and just to make that juggle for us to be able to step in and just say, you know what, these are all the options. You might want to start here and then move forward, and being able to explain the differences to make that less stressful for them.
And it helps out a lot to have that resource. Because like today, I had 2 brothers come to my building freaking out.
Oh, yeah.
And I was like, well, there's these places you can go. And so it's always good to have those resources available for them.
Yeah.
What areas do you cover?
So we cover Solano County and Napa.
Oh, okay.
So everything from Dixon, Vacaville, Fairfield, Rio Vista, Vallejo, Benicia, American Canyon, up through Napa, Yountville area.
So big area.
Yeah.
Do you guys go to the communities and do a walkthrough before referring?
Yes.
Okay. Okay.
Every community Stephanie has stepped into before she refers.
And a lot of the time, Steph will come in and meet the tour there and do the tour. Even though, bless her heart, she's probably heard my spiel, 100 times.
Uh-huh.
She'll still come in.
But I love that.
And
She
smile and
comes in-
pretend like it's the first time she's ever heard me talk about dining.
Yeah. She does for everybody. She walks them through all of them,
And
all
I
the
think
locations.
that's amazing to be able to go walk the community so that way you can share exactly what they provide and what they don't. And I enjoy when they come with the tour.
Yes.
I enjoy that a lot.
Yes. Yeah. Well, and I think as far as supporting the family and the potential resident, it helps because then she's able to talk about the pros and cons of the last one that they saw versus this one, or why she thought this one would be a good fit. And she usually starts with kind of what they're looking for, and then a middle one, and then what she thinks really is going to be the ideal for them based on what their needs are. Because sometimes what they're looking for isn't necessarily what's going to be the best fit for them, right? So sometimes they need a boarding care and they want the large assisted living community, or sometimes they just want a boarding care and they really would benefit much more of the activities and the interactions that they'd get in a larger community. So she kind of works it that way.
That's good. That's really good.
Yeah. So what are some of the biggest challenges that families face when trying to find care for a loved one?
That is a really good question, and it's almost loaded.
I know. There's like 100 ways to answer this. There's 100 problems.
There is, and I feel like every family is different and unique in the dynamics, the needs, and so it's challenges. There's a lot. Some of them are the family members that are now stepping in live out of state or out of town, and so
That's a lot.
it's very stressful for them. So things need to happen quickly for them and smoothly. There's also the instances where it's husband and wife, and the social worker at the hospital is saying they need care at home, and whichever, it doesn't matter whether it's the husband or wife, whoever is the primary caregiver doesn't realize how much care they're actually providing and how stressful that is just on them. I mean, I think the statistic, and correct me if I'm wrong, but it's somewhere like 70 or 73% of the caregiving spouses pass before their medically compromised loved one.
73%.
Yeah. And so, that's where I want to really help people, because, I mean, how fortunate are we if we grow old with a partner that wants to take care of us, right? And is able to take care of us. But that partner needs a break. And a lot of times the person receiving the care also doesn't realize how much that partner's helping them. I mean, and when they can't even go to the grocery store without worrying about rushing to come back home, that's where you need somebody to come in and help, because that person needs that break.
Absolutely.
I mean, I think I could go on endlessly about the various
Definitely.
challenges, the medical struggles, or the spouses that both need care, like somebody ends up with a stroke or some medical compromise, falls or something, and then the loved one has dementia, right? And they're taking care of them, and now they can't take care of them.
And now the caregiver needs care.
Yes, or it's there's a lot.
Or trying to find where they can both go.
Yes, where finding a place for
Staying
both
together.
of them.
Can they stay together?
Yeah.
I feel like those are all very, very good questions that come up so often.
So often, right? Or the spouse that needs the memory care, and the other spouse that doesn't.
Yeah.
But they need to, for financial reasons or whatever, move together. But then who moves into which department, or what I mean, not department, but area of the community.
Or having a company like you that know the communities and know which ones,
Exactly.
like Magnolia Court,
Yes.
that allow folks with dementia to still live in the assisted living program with their spouse.
Yes.
As long as they're safe. As long as they're safe.
Right. Well, but that's why it's so important to reach out to an organization that works with all aspects of senior care.
Definitely.
When you try and go through this journey, when families try and go through this journey, or one member of a family tries to go through this journey on their own, there's so much that they will never know or understand about all the ins and outs. and they will spend countless hours trying to figure things out, and we can take that burden completely off of them.
So that segues right into my next question.
It does.
You basically did it for me. What is the best advice you can give to family members that are looking for in-home care, for an assisted living, for a board-in care? What advice could you give them? What would be the number one thing?
I think the number one thing would be when you have, and we were just talking about this,
I know, we were talking about it.
Is as soon as something happens, even if, as soon as there's that ER visit, your loved one lives at home, or you realize that mom is taking care of dad a lot, or dad's taking care of mom a lot, just start reaching out. Because agencies, such as ours, and there's various other ones out there that are fabulous, we can start helping give that advice and guidance and let you know what's really out there. Just even the basics of when somebody goes into the hospital, the family's kind of thrown into, they need skilled nursing, they need home health, they need home care, they need support at home. And I find actually one of the biggest, going back to challenges, is when people come home from the hospital and the social worker directs them that they need care at home. And so that would be your in-home care. And then the patient also needs home health. And then home health gets ordered for them, which that's covered by insurance. And then the family goes, oh, we don't need home care because we have home health. And they're completely two different things.
Yeah.
And I think the biggest heartbreaker is when you help a family and then they realize, oh, we have home health, and they believe they don't need help, and their loved one gets discharged on a Friday night, and they're scrambling Saturday, Sunday, calling us going, we need help. There's nobody, they only come a couple times a week. Like, we didn't realize we've had this happen so many times.
Yeah.
So
what do you do? So if somebody calls you on Friday, it's like, hey, we need to place, what do you do?
what as far as getting it, or that decided they didn't want to go with the help and now they need it,
Yes.
we step in and help them.
So is there anything that they need, like paperwork that's going to be needed?
So
what's the process?
Yeah, so typically at the time of when we come out and do a visit, and that would usually be Stephanie and my marketer that would come out, we get agreements all signed and completed. If the family decides to hold off on that because they're not sure, or we're not ready to do that, and we really do encourage it, it's so much better to get an agreement signed and get ready to go with an agency and not go with the agency than to be scrambling, because then what happens is now we have to coordinate to get the paperwork done. Now we have to spend time getting them into the system. Now we have to spend time contacting caregivers. And, we have caregivers waiting to work on the weekends, but if there's we can't control life situations, right? If somebody has a car that breaks down or a child that's sick, then we need another caregiver to fill in and cover that client. So it's easier to have things ready to go and cancel last minute than to not start at all and not initiate.
So when they're already calling and they're like, we're thinking about it, you're already like, hey, this is what we should do. So in case this happens, we already have everything ready.
Yes.
Perfect.
Yep. And then
Perfect.
and our weekend scheduling staff can just move forward if you guys need it. It's far better to be prepared like that.
Is there anything else that they would need?
Um,
Because I know for us, we need a 602,
Yeah,
right?
we need medical paperwork.
yeah. So as far as in-home care, no. There
Okay.
isn't anything.
It's
For
a
home,
paid-for service.
it's privately paid. So that is the one thing with home care, is they have to pay for it out of pocket unless they have long-term care or they have VA, and we help coordinate those benefits as well.
Like the Bright Star program.
Yes, yeah. And then for the home health side, that would have been prescribed by the doctor, and they would have had that moving forward.
Okay.
Yeah. But it's pretty easy, just, a phone call and we can get things together.
Okay. So I know we asked a lot of questions.
We went through a lot of things.
Keep going. Okay, so can you tell me a time that you helped a family that you can remember till this day, that you're like, you know what, I was able to help this family? Can you remember a time?
Actually, so there are a lot of them. I've been fortunate to start up and stay in business for a little over 10 years, but there's a lot that are very heartwarming. I'd have to say I have a few that are near and dear to my heart that come to mind. I think my very first client, when I first started out, probably
Your first love.
yeah, because I had never done hands-on caregiving. It was a drive for me to help and see how I could grow an agency and create a team together so we could care for as many seniors as possible. And this gentleman was just amazing. He traveled a lot. He happened to be bedbound at the time, and scheduling staff and just starting. And I went and helped him almost every weekend for quite a few months. And it started out both days, and then cut down to just one day. And then as my caregiving staff started building up, and but it just sharing his travels. Watching CSI on TV with him.
Love that show.
he loved cooking. He used to do travel vacations, and actually because of him,
What a cool guy.
I know, because of him, I actually do foodie tours anytime I travel.
Stop it.
That's right up Mary's
Kid you
alley.
not,
that is
I
so cool.
love doing foodie tours, and it was because of him that I started doing that. And I don't think I really travel anywhere now that I don't try and squeeze in an afternoon of a foodie tour.
That's cool.
Yeah, and so he got me, cooking more. Like he had these cookbooks, and he had certain recipes, and he remembered what pages they were on, and go to this cookbook, page 134, and I'm like, okay, and cooking, and it was just, this is exactly what I want to do for as many people as I can. I mean, obviously I don't really do much hands-on, but I do on occasion. We get people, and I'm like, I will go take them to the grocery store. I'll take, if I'm running in and they're trying to scramble to find someone, I'm like, I'll go, I'll pick them up, I'll take them to the grocery store.
But how amazing is that? Like
Yeah.
So
you
fortunate.
started like at the beginning position. You wore so many hats, and you got to actually do the care and take your seniors out and do
Yeah.
things like that, and you still do it to this day.
Yeah.
Pretty amazing, girly.
Thank you.
I love hands-on.
I love hands-on.
Yes.
There's something-
Owners who are hands-on are the best.
There's something really special about it. I mean, I have to say, as an owner, there comes a point where you do kind of want to step out and have your team run the show, and just that warms my heart too when I see everybody just like coming together and making things happen and problem solving and helping the families and the clients. I also like stepping in and hearing their stories, especially our veterans. I mean, I've heard some great stories,
amazing stories.
And you just go, wow, people that worked on the submarine and go to their apartment and everything is so perfectly organized. I'm like, how do you fit all this in here? And then they roll into their stories about, when they were out on the submarine for months and a year, and it's really fun. It's fun. It's unique and special.
Definitely.
So if someone needed to get a hold of you, how would they be able to find you guys?
Us?
Yeah.
Okay. So Google us, Always Best Care Senior Services, our website, abcnapasolano.com, reaching out, DMing our post, any of that, following us on Instagram, Facebook, TikTok, things like that.
Do you want to give them your phone number? Your office phone number?
Yeah, absolutely. Also, they can also just call our office at 707-317-1740, and we can help get them set up and just, start them on to understand the journey and the process before there's that crisis.
If there is someone looking for guidance, is there something that you could tell them?
Call us.
Okay.
Let us help. We're not here, nor are other agencies, but we're not here to pressure to provide you care and services, and for a financial, like, we're not looking for financial gain by helping them, but being able to help and guide is much more rewarding. If it comes down that you do need the help and they need the help with care or placement or anything, we are more than happy to do that. But I think it's much more rewarding when we sit in our staff meetings and we go about like what happened last week, and when we hear Stephanie and other people in my team share with me how they helped other people or supported them or guided them, and I'm going to still reach out to them, but this is where they're at in their journey. I like hearing and seeing that, in that process.
So your placement services, they're free, right, for the families?
Yes, they are free for the families, and there's no cost for any consultation with our agency, for any placement services, the tours that Stephanie does, the research, the phone calls, all of that, gathering paperwork, all of that. That's all part of just our service.
And home health is covered by insurance.
Yep, and home health is covered by
What's
insurance. So home health is typically covered by Medicare, Medicare Advantage, also other private insurances that people may have, United Healthcare, Lucent, Imperial. There's a whole vast
does
TriWest.
long-term care pay for that?
So long-term care will pay for the in-home care,
Okay.
and there are some long-term care insurances that will cover home health. Also, there's some people that have long-term workers' comp issues and deal with workers' comp insurance for home health care.
Really?
Yeah, that will
Yeah.
cover as well, and for
I know
in-home
that.
care. Yeah.
Well,
Yeah.
something new.
Yeah. We also work very closely with the VA, and so we're contracted with the VA.
Bright Star. I think there's something states.
Something states there's and there's also the guide program.
The guide program.
Yes, guide program. That's up to 76 hours per year.
What's guide?
So guide it's actually an acronym, and I can't remember exactly what the acronym is. But to wrap it up in a nutshell, it is an in-home care benefit for a Medicare, traditional Medicare, red, white, and blue traditional Medicare card holder that is diagnosed with Alzheimer's or dementia and lives at home. It is a respite care of up to 76 hours a year, and Medicare will reimburse for that care. So it's free 76 hours of care. Yes. So
Just a year, huh?
I know it's not very much. It's not very much. It's one of those things, kind of like the VA benefit.
It's like an emergency.
It's an
respite
emergency.
coverage.
It's a contribution. That's how I like to say it. It's a contribution to their care need. I think it would be great if Medicare could step up on the in-home care side and
A
help.
little bit more,
And
right?
we could have a whole podcast on how
Oh.
like insurance has not caught up with the needs of our
and
agency nurse.
if you do, please let me join in, because
Girl,
I
we'll have
would
this whole room
love
full.
to be there for that. Because yes, I mean the actual need is far surpasses.
Yeah.
But it is nice to know that there is that little option if a loved one needs to take
Yeah.
a couple days or something. But yeah.
Definitely.
Okay, well, that brings us to the end. So whether you're looking for a trusted local service, expert advice, or simply want to hear some stories about and behind the people that serve our community, you're in the right place.
I'm Mary. Thank you for joining us, Community Connections with Mary.
Thank you for joining us for another great conversation with REM Community Care Connections with Mary and today Tasha. Thank you, Rebecca. Thank you so much.
Thank you so much for having me. It was fabulous.